there's also something to be said about being there for your clients and being professional and in your role as a part of a team. And I think that perhaps one of the pitfalls that doulas make is looking at their role as it's either or, it's us against them, rather than trusting our clients that they chose providers that are right for them.
Right.
And the more that we can just shed that kind of armor in the space and just be there for our clients, rather than feeling like we need to protect them from the decisions that they had already made, then the providers can relax a little bit too and say, well, I have my job to do, the doula has their job to do. And we're all here for the right reasons. We're all here for the same reasons. It's a positive outcome, right?
Well, I mean, so there's a couple things there. Like, I mean, one, I guess I would ask you, what is professionalism for a doula?
Right. Professionalism for a doula is working within your integrity, ethically, for the interest of your client, first and foremost, because they hire you. I mean, even thinking in terms of why they hired you. I mean, why are doulas even needed?
Right.
We need to hire somebody we don't know to come in and be our advocate, where you look at families cross-culturally, and this is something that's kind of built in, right, usually. So within that, there's a lot to talk about. But in being professional, we take on that role of the friend and the family member and that person who's strictly there for your interests. But we also understand that we are there for the profession as well. So when we step into the space, we're ethical, we are, we have integrity, and we let the providers know that we're not trying to do their jobs, so that they understand, hey, well, I had this really great experience with a doula. I think doulas are really valuable. I think all of my patients should have doulas, right? And so there's those two pieces in walking that line of, I'm here for you 100%. I'm also here in representation of my community. And what does that look like? And so I talk about having professional agreements in the doula community rather than a scope of practice and a toolkit.
Nice.
Right? And if we can all be in agreement about what we do professionally and what our toolkit is, then we can just practice freely.
Right.
And it's easy not to diagnose or prescribe if you're not a trained medical professional.
Right. I mean, you mentioned one aspect of professionalism is letting the providers know that we're not trying to do their job, but what does that mean? What does that look like? Don't worry, I won't be doing this C-section.
Yeah,
Exactly. Are you kidding?
Yeah.
And so what are we really talking about when we're talking about reassuring the providers? And again, I could see how the language of scope of practice may have emerged in those conversations.
Yeah.
So it's like the doula is trying to meet the doctor where the doctor is. They talk scope of practice, so let's just talk the language they understand.
Right.
Our scope of practice is to rub her back. But what happens if again, I don't think that doulas have necessarily been conscious of where they're going when the significance of the adoption of that language, and the equally valid option of simply saying, this is what we do, and here is what we don't do. And in that sense, maybe we should talk a little bit about communication with the client around the client's decisions, because I guess so let's talk about that, because that, as you know, that's one of the issues that comes up around scope of practice for doulas. In a way, that's sort of the most contentious issue of policing within the doula community. When we're talking about what we don't do, it's usually not assuring the doctor that I'm not going to give a C-section. It usually is assuring the doctor that I won't contradict you or undermine your advice.
Yes, thank you for saying that. Absolutely. And that's something that I think is built into this work, as when I keep using the word advocate and even activist in birth work, is that what we're doing by being present is creating change, right? So we are actively creating change. There's no way around it.
Right.
Activism is built into what we do. And
Just by being in the room.
Just by being in the room.
Yeah.
And advocacy is built into what we do. We say in our professional title and the description of our role is that we give informational support.
Right.
But then there's this piece where doulas get so stuck at how much much information can I give? What language can I use to not, you know, ruffle the feathers of the provider and to stay in this kind of umbrella of professional agreements? And so I think that this is a really important question to talk about. And for me, it's always been kind of fostering maximum self-determination upon my client and reminding them of their rights and prompting questions and kind of facilitating dialogue between my client and their provider when situations come up, and making sure that their rights are being honored, right? The right to understand what's being told to them, the right to having some time and space to make a decision, their right to say yes or no, their right to understanding risk, benefits, alternatives, and alternatives being saying no. And when, you know, more often than not, you're noticing that this dialogue kind of gets more and more one-sided, or bits are left out, or bits are forgotten, me as the doula, I see myself standing up and saying, okay, did you understand what was told to you? Now, are there more risks? Are there more benefits? What are more options that we have? And some doulas are afraid to do that because they think that this is speaking for the client or interfering. So I'd like to hear your perspective on this.
Well, in a way, it circles back to a point that you made when you started talking about professionalism, which is that doula's part of being professional when you go into the room is not going in combative, and I do want to circle back to the question of acting ethical and the question of what does it mean to act ethical. But if we just put that aside for a second and focus on going in there and representing doulas and you said and not being oppositional, so not assuming that there's a problem with the other side. There's no dualism here. We are all one team, and at the same time, the purpose of our interview is advocacy. So there exists a situation that you shouldn't go in there assuming that the situation is there, because then you're creating it.
Yes.
But that it might arise, and that's the reason doulas exist. Let's be real, because the requirements of the institution have made it really hard for women to get individualized care. You know what I mean? The bigger the hospital, the sort of more rigid its parameters, as a general rule. And maybe there's exceptions to that for hospitals that are really committed to trying to give individualized care. But it's because of that rigidity, and women have the doula there to try to shift that dynamic and hold a little bit more space where they can get the treatment that they need and not the treatments that they don't need.